Director of Gracer Medical Group in San Ramon, has written a comprehensive plan that's aimed at stopping addiction cravings. His management and recovery program is outlined in this new book. It's called A New Prescription for Addiction, and we welcome author and Dr. Richard Gracer this morning. Thanks for coming in and joining us. In the book, you're talking about the hidden addict. Why don't you explain to our viewers what the hidden addict is? Right.
Well, the hidden addict are people just like you and me. There are people in society that we see every day. If you're at a restaurant or if you're in even a ballpark, 10 to 15% of those people have drug problems. The question is, who are they? There's no way to really tell. We interact with them and they seemingly are quite normal. Unfortunately, many of them are just desperate and are trapped.
And as you mentioned, it could be the person sitting next to you at the movie theater, at the ballpark, whatever it might be. So are there any warning signs that people can look at to tell if this person's a hidden addict?
Well, of course, you have to know them better than just somebody sitting next to a restaurant.
Right.
But there are things like tardiness from work and things in the family becomes obvious as people start to unravel. But the real secret is to ask people if you have a suspicion or a problem. We hide this problem. We don't want to deal with this problem. So the main thing is that if you do have a suspicion or someone in your family or coworker, just ask.
Ask them or ask the coworkers?
Well, you could even ask them.
So you're talking about almost like an intervention here.
Right. In other words, bring up the subject. Certainly if it's a family member, you don't want to be what I call a codependent, which is somebody who enables it. But the real thing is that a lot of these people will tell you. Now, the people I say to just ask are doctors, family doctors and so forth, because a lot of times the doctor is the last one to know.
It's interesting to find out. What are the main components of your program? How does it differ from other programs?
Right. Well, my program was set up to deal with cravings. In other words, the reason that people relapse is because they have cravings for the drugs. A lot of times, even after they detox, which is the classic way that we deal with this, where we get them off of alcohol or other drugs, this goes on and on. It's called the post-acute withdrawal syndrome, and they can feel bad for years, sometimes permanently, especially with methamphetamine, and for some people with opiates like OxyContin and Norco and so forth. So we have to deal with that primarily. Then what we do is we look at everything else. You have to do everything. We look at the psychosocial. We deal with them for at least a year. That's the other thing. You must be in treatment at least a year, because if you're out on your own, you can get into trouble, so to speak, old habits. We look at the nutritional problems. Another problem that is overlooked very commonly is looking at psychiatric problems, because the mental health and the substance abuse things are very, very separate a lot of times. And people who are treated for substance abuse are treated for that, substance abuse, without regard to necessarily the fact they may have depression or bipolar.
So there's a lot of contributing factors that could lead to this addiction, and what you're saying is that you take more of a holistic approach, looking at a wide range of possibilities here.
Right. You have to look at each person separately. So one size does not fit all. That's another thing that we say a lot. So we do a lot of personal intervention and personal evaluation.
Tell us a little bit about the other difference that you have, and that is the private treatment versus public clinics, the 12-step programs where people sit in a circle and talk about their various issues and problems.
Right.
You don't subscribe to that.
Well, we use everything, so I don't denigrate any program. 12 steps are very, very valuable, and we encourage our patients to go there if they're comfortable. But remember, these people are people like you and me who are going to be reticent to actually get up in public and say, I am an addict and so forth.
Right.
And also, like, the other alternatives for prescription drugs are things like methadone clinics. We have to line up every day at a public methadone clinic. People don't want to do that. So there are treatments that have been developed that can be done privately in the doctor's office. So my patients come to a doctor's office with everybody else. They're not stigmatized. A lot of people can engage with a therapist one-on-one and get a very close relationship. Eventually, sometimes we do have some groups for these people once they're comfortable. But you have to basically play the ball where it lies, and that's the secret of treating these people.
One thing that you mentioned earlier was that your program lasts at the very least a year. Is that something else that's different compared to other programs, is the longevity of treatment?
There are programs, of course, that last quite a while, but the typical treatment program is detox for a few days, maybe a month or two in an intensive kind of treatment, maybe even residential somewhere fancy or nice or whatever.
Sure.
And then eventually you get sent home to a 12-step program or a local program where there isn't any ongoing supervision. We feel that people need to be engaged with the therapist for a year. They have the doctor available, nutritionist. We even have an acupuncturist. But the other thing that we do is we deal with these cravings, and that can take quite a while. Depending on the drug, there's something we use called Prometa, which is a new protocol for methamphetamine and cocaine, and also for alcoholism that actually helps fix the brain disease, because this is the crux of the matter. And then for opiates or prescription drug addiction, we're using buprenorphine, Subutex, Suboxone's the names of those, that also work on the receptors, and that's what helps people get over the tendency to relapse so quickly.
We're just about out of time. A lot more questions to ask you, but I want to remind folks about the name of the book, A New Prescription for Addiction. It's a comprehensive treatment plan. Dr. Richard Gracer is the author of the book. Your offices are in San Ramon. If people would like more information, they can go to that website, newprescriptionforaddiction.com.
Okay, thank you very much.
Thanks for joining us. Coming up next.